This is Dr. Deukmedjian, CEO and founder of Deuk Spine Institute. We are streaming live spine surgery Thursday, August 20th, 2026. Our patient is a Floridian. She's had problems with her neck pain into her shoulders and her arms. These symptoms have been going on for 20 years. We did an MRI review with her. Turns out she has 2 herniated discs that are causing the symptoms in her neck and arms, such as radiculopathy, pain, weakness in the hands, numbness, and tingling. She did not want to do a spinal fusion, which is what was offered to her by other doctors. So she came to Deuk Spine Institute for endoscopic laser disc repair. That's what we'll be performing at this time. We need to treat 2 discs, C5-C7 and C6-C7. Everyone agree? It's a left approach, C5-C7, C6-C7. I need maximal relaxation. Are we there?
Yes.
Huh? Yeah? How long ago? Think it's enough time? Shot? 2, 3, 4, 5. I need a little more pull in the shoulders, Luis, both sides. Shot? Shot? 2, 3, 4, 5, 6, 7. Looks good. Right there, huh, Luis? Shot? AP. Stay still, everyone. Don't move. Quick shot. Jordan's got to move quick. Shot? Lateral. Looks good to me. Huh, Luis? Shot? All right, almost there. Hang in there, guys and gals. Shot? Just about there. You agree that's 6-7? Shot? All right, let's get an AP. 2, 3, 4, 5, 6, 7. Let me have a coker. Relax, Luis. Take your time, Jordan. Let's get a good AP. Shot? That looks perfect. We're dead center. I love it. All right, we've placed our spinal needle through the skin. The whole surgery will be done arthroscopically on the spine. This is true arthroscopic surgery. This technique was developed by the Koreans, South Koreans, specifically Dr. Sang-ho Lee, who is the founder and president of Woodidal Hospital in Korea. Shot? And people travel all over the world to have him perform spinal endoscopic cervical disc surgery. He's retired now, and the Koreans have sort of fallen behind, in my opinion, with this type of surgery. But I learned it 20 years ago overseas and brought it to the United States. I've been doing this surgery now 20 years. We've performed how many of these endoscopic laser spine surgeries here at Deuk Spine Institute, Anthony?
It'll be 2,796.
2,796.
Yes, yeah.
Is that right?
Yes.
There you go. Almost 3,000. Deuk laser disc repair surgeries. 2, 3, 4, 5, 6, 7. And our success rate is 99.6% elimination of neck pain, headaches, arm symptoms in patients that have those symptoms, which is why we do the surgery. We're going to start here in her case at C6-7. She has a large herniation with an osteophyte, disc osteophyte complex, very common problem. Do we need to come up there and pick you up, Dr. Berndaves?
No.
All right, if you have questions, feel free to ask. The way you ask questions, folks, type it up on your screen. In the meantime, while we're gaining access endoscopically, let's give the audience a video that shows the 30 different causes of neck pain. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. You've seen there are 30 very specific causes of neck pain. In her case, we've already treated her facet joints on both sides from C3-4, C4-5, C5-6, C6-7, and I had to do C7-T1. She had tons of arthritis. We've already treated it with a rhizotomy of the medial branch of the dorsal ramus. We've now flipped her over and we're doing laser spine surgery to repair 2 cervical discs. This is the blood from the entire surgery right there. We have 1 drop of blood. This surgery you're watching is the newest, most advanced spine surgery in the world, in my opinion. And it's used to treat herniated discs, degenerated discs, spondylosis, protruded disc, extruded disc, ruptured discs. We've been doing this surgery now for 20 years almost, and we have not had a single surgical complication. It's very safe. It's the only surgery on the spine in the world without a surgical complication. All other types of surgery have complications, but not this one. So, who benefits from a surgery with no complications? Why, the patient does, right? Actually, if you have a complication, the surgeon makes more money treating a complication. Thank you, Jordan. So, the hospital makes more money treating the complication. The insurance company benefits because even though they have to pay for the complications that happen with spine surgery, it causes patients to not want to do spine surgery, which in the end saves the insurance company billions and billions of dollars every year. People being afraid of spine surgery because of complications, and you should be. But the Deuk laser disc repair, no complications to date, no surgery complications. It's been peer-reviewed and published in the medical literature 11 times. Right, Anthony? We have 11 publications, peer-reviewed publications.
Yes, we do.
In addition, we have patents. The procedure you're watching is completely FDA approved. We don't use any drugs, devices, tools that are not approved by the FDA. There's a lot of misinformation out there on the internet about laser spine surgery. There's rumors and misinformation that's perpetuated by fusion surgeons who don't want you finding out just how good laser spine surgery really is. By the way, I get the question, does the laser remove bone spurs? That's what we've been removing this whole time, bone spurs. So I'm removing some herniation too, but a lot of bone spurs. Any questions?
Yes. We have a question from Michael on YouTube.
Hi, Michael. Welcome to our stream. You okay, Luis?
Hi, Dr. Deuk. Hope you have been doing well.
Thank you, Michael. Hope you're well too.
Will this patient have immediate pain relief after the DLDR?
Will this patient have immediate pain relief after the Deuk laser disc repair? The answer is yes, she will. Now, remember, she's going to have pain that I just gave her today from the surgery, specifically pain in the back of her neck from the Deuk plasma rhizotomy. This is a patient who has not just a herniated disc that's causing symptoms, but also she has facet joint pain. We've already treated her facet joints. If you want to watch that procedure, it's there on YouTube. I think the tube is kinking. It's my irrigation tube. Can you check that? There's something wrong with this system, and I don't like it. I think that tube kinks too much. Is there a different kind of IV line we can? I can supply different. Because we never had this problem until the last couple of months. I think with that hard plastic and the transition to the very soft tube, that's what's causing the kink. Watch that laser fiber. It's going to hit my face if you're not careful. I mean, it's really coming close. So go ahead and adjust it. So I hope that answers your question. She will have immediate relief when she wakes up. However, she's going to have a new pain that I gave her from the Deuk plasma rhizotomy, which is done in the back of the neck, and it hurts. People that have our cervical Deuk plasma rhizotomy, they complain about a new type of neck pain from the surgery, typically lasting a few days to a few weeks. The longest I've ever had is a few weeks, but there's another thing that you have to take into consideration. People that have facet pain in their neck, they don't move their neck normally. So their muscles in their neck atrophy. And when your muscles atrophy, they build up lactic acid very easily, and they start to hurt. So these people have really bad neck pain that comes from the muscles after we fix their joint pain. And the muscle pain requires you to do physical therapy to get rid of it. So I can't fix muscle pain except for piriformis, and the rest of the muscle pain, the patient must fix themselves. Great question. All right, let's show the audience how herniated discs in the neck at C5-6 and C6-7 can cause so much pain, neck pain for patients. And by the way, her surgery is going beautiful. These are all bone spurs. Half of what I'm taking out are bone spurs here. And all this is being done without fusion, without hospitalization, without pain medication after surgery. No narcotic pain meds needed. No complications to date. So we've had very successful procedures with the laser. You can see just before you go to the video, that laser fiber there at 12 o'clock, that's the laser fiber. It is 1/2 millimeter, 0.5 millimeter wide. So think about that. You guys are seeing something that your own eye can't even see if you were looking at it. It's that skinny. And it looks big in this picture because the endoscope enlarges everything, makes it visible. That's why we do this endoscopically. We do it for precision and accuracy of the surgery. Okay.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. Oh. We are just about finished with C6-7. You can see the lateral part of the foramen. I've zapped away the bone spurs. These are all bone spurs here. They don't bleed too much, which is good because they don't have a lot of diploic bone in them. They're just cortical bone. But now I've gotten the pressure off her nerve. The nerve is just down there. And you can see the foraminal ligament. It's shiny just underneath the last bit of bone spur right there. All this is done with a cool laser. The laser doesn't get hot because we have a system that keeps it cool. All right, any questions?
Yes. We have a question from Lanu on YouTube.
Sure.
Not only is the insurance greedy, but I also think they want to imprison the population. Why is the insurance so evil?
Yeah, great question, Lanu. Why is insurance evil? Look, human nature is to be greedy. It's only through culture and learning, education, that we learn to not be so greedy. Truth is, human beings can't survive alone. Greed is very selfish. And greed helps the few at the expense of the many. That's what the insurance companies are doing. They're helping a few people get super rich, like Berkshire Hathaway Insurance. What's his name? Warren Buffett. Okay, he owns insurance. His insurance, Berkshire Hathaway, has denied treatment for patients that are beneficiaries and refused to pay surgery that's necessary to give them their life back after horrific injuries that happen at work, for example. Why do the rich want to just get richer at the expense of people? That's a great question. That's not a question I can answer for you. Yeah. They don't kill. They suck and suck and suck. Dr. Berndes made the comment, a parasite should never kill its host. The parasite being the insurance companies, the host being people. And he said that the insurance companies should never kill the patients, but they are killing patients a little bit, right? They're killing them a little bit. So more and more people will have to die before society wakes up and realizes just how harmful health insurance companies are. And in America right now, the Democrats want Medicare for all. I don't know if they realize that Medicare is run by for-profit insurance companies like Blue Cross, United Healthcare, Aetna, and Cigna. All of Medicare in the United States is managed by United Healthcare, Humana, Blue Cross, Cigna, and Aetna. Every single Medicare policy. And there are Medicare Advantage plans that are also managed by these companies. So if we do Medicare for all, it's only going to make the insurance companies richer, and it's going to take away more from the people. So I don't know what the Democrats are thinking. I don't think they really understand how health insurance works. It's unfortunate that our politicians are being lied to, and they're basically being suckered. So it's not a problem I can fix. Society's going to have to suffer more before they realize this parasite is sucking them dry. All I can do is do my best to help people that want to be fixed. All right, we come out of 6-7, we're moving to 5-6. 2, 3, 4, 5, 6. Sean? I'm a little bit to her right. I'm going to correct the tip and move it over to the left side just a little bit. Remember, this patient's had pain in her neck for 20 years. And I think today we're going to take a big chunk out of it, if not cure it completely. All right, lateral. Any questions?
Yes, we have a question
John?
from Michael on YouTube.
Hi, Michael. Welcome. Sure.
He was asking, we're using the laser inside or outside of the disc?
We use the laser inside the herniation and annular tear. So it's in the back of the disc. Technically, it's both outside and inside. AP? The herniation is actually inside the back wall of the disc, called the annular wall. It's about maybe a centimeter thick, and it's torn, and there's a herniation in it. So I'm cleaning the wall of the disc. In addition, I'm also Sean? Let's see. Sean? Let's get an AP. In addition to cleaning the wall or annulus that's torn with a piece of herniation stuck in it, what's that? What's moving?
Are you moving, Dr. B? No.
Shez, where is she? Still down?
Yeah.
Lateral. Well, somebody was moving her. All right, let's see if we can get above this lip. Sean? Give me some distraction. Sean? 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 Just about there. Sean? I like it. That's perfect. All right, any other questions?
No questions.
We've shown the audience the 30 causes of neck pain. We've shown the audience how a disc injury causes neck pain. We've
Yes.
shown the audience how the Deuk laser disc repair surgery fixes discogenic neck pain.
No.
Let's do that.
Okay.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. Let's show the x-ray. So, Jordan, count for us. We have 2, 3, 4, 5, 6. Can you guys see when we count? Can you see the arrow moving?
Yes, we can.
All right, the tube is, take another x-ray. The tube, end of the tube is right there at the back of the disc. You guys see that?
Yes.
So when I do the surgery, I'm going to go into that herniation and zap it away. The herniation is sticking out the back of the disc. That's what we're removing. And once we remove the herniation, we debride or clean the tear in the annulus. And that ends up allowing the patient to heal properly. They repair their own disc. The laser is an extremely good tool for removing bad tissue, abnormal tissue. That's why they use lasers now to take out brain tumors. Many people didn't know that. Lasers are being used to remove brain tumors with minimally invasive surgery, where people go home the same day. They're also being used to remove epilepsy focus in the brain, causing epilepsy. Rotate. So we use lasers in medicine with many applications. I foresee lasers being used more and more in the future. I think they're going to become just more and more popular with people and doctors. As we get better with lasers, we're going to have better outcomes, better results for patients. And honestly, it's a shame that more doctors aren't learning how to do these advanced techniques. More doctors in the world. It takes, obviously, equipment, which most doctors don't have, and training, which unfortunately a lot of doctors don't have access to. But one of the biggest problems is we're back, right?
Yes, we are.
One of the biggest problems, to be honest with you, is that a lot of doctors aren't really interested in doing surgeries that don't pay them more. This surgery pays the surgeon very little compared to a fusion. If I do fusion surgery, I make a lot more money. So I believe this is better for the patients, but it's not necessarily better for the surgeon. So that may be why we're dealing with a situation where a lot of surgeons refuse to do these less invasive surgeries or recommend them because they're going to take a huge pay cut. Wow, this is a mess. This is all herniation and bone spur down here. Sitting right on top of her spinal cord, which is not good. So, this has been here for a very long time, and what I'm seeing is there are parts that are old and there are parts that are new, mostly old, mostly like 20, 30 years old. She says she's had these problems for 20 years. I think it's been probably longer than 20 years. I think this injury happened probably when she was just a child. And for the last 20 years, it's gotten to the point where she's symptomatic. Berndes, 5 minutes. Man, there are some massive, massive bone spurs and pieces of herniation here. All of it's scarred down with scar tissue from inflammation that's been going on for 20 years or longer. Any questions?
Yes, we have two. One from Lanu on YouTube.
Sure.
This patient has arthritis. I wonder, is the arthritis causing C5 through C7 pain?
The question was from Lanu, is it arthritis causing what now?
Is the arthritis causing C5 through C7 pain?
Yes, the arthritis is definitely causing her pain. She's got arthritis on both sides of her spine, the front and the back, which is why we've had to treat both sides. I started her surgery by going through the back and treating her facet joints, which are full of arthritis and very painful. Then I'm finishing her surgery today by doing the herniated discs. That's what we're on right now. We're fixing those herniated discs. Remember, when I do these surgeries, we're working in a very small space, and the disc is never going to look normal even after surgery. There's no spine surgery that can be done on Earth today that will make your disc look normal again. There's nothing. All we can do is treat the symptoms, and the symptoms are coming from this herniation back here that is just scarred up. Look at all the scar tissue. It's amazing. But look how precise the laser can remove the scar tissue. Very safely, right off of the spinal cord here. This is a piece of herniation right there. It's a torn annulus. This is on her left side. There's a big bone spur right there. So she's developing what we call calcified disc herniation. So all that is calcium right there. So people ask, Dr. Deuk, can you remove calcium? And the answer is yes, I can remove bone spurs and calcium. But I don't take away all the calcium. I only take away the parts that need to be taken away. Why? Because if I try to get everything, I'm going to end up creating problems for the patient. Okay? If you are too aggressive in your surgery, you can actually do more harm than good. So there's a balance that a surgeon has to figure out. How do I remove enough to give the patient good symptom relief, what we call maximal symptom relief, and yet at the same time not cause problems for the patient? And that's the balance you have to find as a surgeon. It takes a lot of experience and knowledge to be able to do that. All right, we're just about finished. We've shown the audience the 30 causes of neck pain. We've shown the audience how disc problems become painful, right? Through inflammation.
Yes, we have.
Now, have we shown the audience how we fix these herniated discs? I think we have.
Yes, we have.
All right, good. Any questions from our audience?
Yes, we have a question from Nielsen on YouTube.
Hi, welcome.
Hello, doctor. Do
Hi.
you still do fusions?
Do I still do fusions? I do, very rarely though, because 95% of people's problems can be fixed without fusions. So there's no real need to do fusions. I don't have people wanting fusions. They don't call me and say, do a fusion for me. Everybody wants less invasive surgery, which is good. And I will do less invasive surgery if it's going to work. I tell people the chance of it working. Like in this patient, I told her there's about a 90% chance this surgery will fix your problem. Okay? Now, why is hers only 90%? Because she's got such a bad problem that there is a chance, 10%, that my surgery will not work. But then again, every doctor has a chance their surgery will not work, right? There's no doctor who's going to tell you that the surgery will 100% work. You know, the most I'll give somebody is 99. Now, if people say, what's the chance I'll have improvement? I'll tell them 100%. You're gonna have improvement. But what's the chance I'll cure you? Completely cure you. And that's going to be about 95% of the time I can completely cure my patients. Okay, which is more than any other doctor, by the way. That's because of my experience and my diagnostic abilities and my surgical treatments that I pioneered. And by the way, it doesn't matter if I do this surgery or a really good other surgeon does the surgery. The results will be the same. It's not me necessarily that makes the surgery work. It's the surgery that makes the surgery work. It's the patient's issue that makes the surgery work. So as long as you choose the right surgery for the patient, then the chance the surgery will work is independent of who does it, you know, as long as they do the surgery properly. That's always been a big issue for me, is quality control. People are always asking me, when are you going to teach other doctors to do your surgery? And my answer is when I find a doctor who I trust will do a great job and not hurt the patient. Because we don't want to hurt patients, we want to help patients. And all too many times doctors will do treatments that help the doctor and not the patient. You understand? So I got 1 minute left. So for me, my philosophy in medicine and life is first do no harm. You as a doctor have a responsibility to your patients and to everyone, the community, the society, that you're not going to harm people. And if I train someone to do this surgery and they're careless, reckless, and they don't do the surgery the right way, they have complications, I feel responsible for that, and I don't want that to happen. So I'm very particular about who I will train to do these surgeries. I don't have an obligation to train anyone. I don't work at a university where I'm forced to train residents. All right? I get to pick and choose who I train. All right, any other questions? Because we're done. This is the last of the bone spurs I need to remove.
Yes, we have a question from the Classic Car Nut on YouTube.
Welcome back, Classic Car Nut. It's been a while. Dilator.
Yes, his question is,
I can't hear you.
with my L4, L5 central lateral recess stenosis, can DLDR adequately decompress all the areas causing my bilateral leg pain / foot symptoms?
The answer is yes. DLDR has never failed to treat symptomatic stenosis. Never. All right? Now, I need to see your MRI. I need to examine you to see if your symptoms are truly coming from there. But you got to do an MRI review. I'm happy to do another one. Folks, look at this. Here's the chin. Her face is here. She has a tube in because she's under anesthesia. This thing is literally 4 millimeters. There's been no bleeding. She's going to go home in an hour. You cannot find this anywhere else. All the other surgeons will slit your neck open, cut through your muscle, cut through your esophagus and other tissues potentially, damage nerves and ligaments, and then put in take the disc out and put in a metal plate. All right, all through a big incision. You're going to have trouble swallowing for weeks, hoarseness, and complications from the surgery. With ours, it's very elegant. We fix the problem in the back of the disc. We don't have to fuse. We don't put in metal. We don't put in biologics at this time. All we do is just go in and use a laser to clean out the herniation and clean out the annular tear. We'll be back shortly with another surgery. Our next patient is thoracic. He's coming from the Virgin Islands, right? He's a doctor, and he has 4 herniated discs in the thoracic spine, along with some facet pain and a piriformis, right? We're going to fix all of that. So come back and join us. Any other questions at this time?
Yes, the Classic Car Nut want to add that he's being offered an interlaminar fully endoscopic approach by Dr. Jay Shen from New York. Would that help him more than a DLDR?
Oh, absolutely not. The reason we do the DLDR is because it helps the most of all surgeries out there. It's going to be your best option. The question is, are all your symptoms you're describing right now, are they all due to the stenosis? You're saying it is. I don't believe you. I don't believe it is. I need to believe it myself. So I don't trust other doctors' opinions because they're wrong most of the time. And I certainly don't trust an MRI because an MRI is wrong. It never tells you where people's symptoms are coming from. That's my job. I trust my opinion. So the first thing you're going to want to do is figure out what's causing your symptoms by a Zoom call. Then you can ask me if endoscopic surgery, interlaminar or translaminar, is going to work. And I'll tell you. All right? But do the Zoom call. Great talking to you again. Any other questions?
Yes, we have a question from Lanu. Oh, wait a second. Oh, yeah, this patient has so much arthritis. I wonder what happened to her in the past.
Well, the reason people get severe arthritis is twofold. One, the injury to the spine, and it can be a mild, moderate, or severe injury. And the more severe the injury to the joints, the more arthritis you're going to get. Number 2 is duration. How long ago was the injury? The longer ago the injury to the joint was, the more arthritis there will be. And 3 is your body's tendency to produce inflammation. So the more prone you are to inflammation, the worse the arthritis will be. So severity of injury, duration of injury, and your body's individual propensity for inflammation. Thanks for joining us. We'll be back shortly with another live spine surgery broadcast. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
Infusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, do you have a herniated disc? I can fix you. And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, you're done already? The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.